Legacy Hospice. Compassion at the end of life. Our standard of care for our patients must always be at the level we would give to our own family. Visit us today at legacyhospicecares.com.
Hello everyone, I'm Dr. Lopez Tan, one of the medical directors for Legacy Hospice in Milwaukee, Wisconsin. With the pandemic and all the changes we have to face today, I'm here to talk about simple COVID reminders to improve safe practices for COVID-19. Infection prevention and control, or IPC, is the practice of stopping the spread of infections during healthcare delivery. As noted by the CDC in the context of COVID-19, the goal of IPC is to contain and prevent the spread of the virus within healthcare facilities and provide safety for the patients and healthcare workers. Standard and transmission-based precautions include a good understanding of hand hygiene, proper use of personal protective equipment or PPE, respiratory hygiene and cough etiquette, cleaning and disinfection of devices and environmental surfaces, to name a few. As a quick review, with focus on long-term care facilities and the use of PPE, here are just a few points to remember. Make sure you wear a medical mask that fits properly and provides a good seal to reduce the risk of inhaling viral particles. Wear eye protection, such as goggles or a face shield. Wear a clean, non-sterile long-sleeve gown that covers your neck and full torso. And finally, use gloves for hand protection. Remember that there is a higher risk of self-contamination when removing PPE. Remember that the contaminated surfaces of your PPE should be removed carefully. It is a good practice to fold the gown inside out and dispose of them properly in a waste container. Please avoid walking around in your facility with used PPE left on after you leave the patient's room. There are specific guidelines by the CDC regarding the safe use and also the reuse of PPE, and make sure you're aware of these precautions and guidelines. This is Dr. Lopez Tan with a quick review for COVID-19 from Legacy Hospice. Thank you.